It's Monday, February 22. This is the news on PBCJ. I'm Simone Absalom Gale. In addition to the over $5 billion Jamaican dollars that the government of Jamaica has allocated to spend on procuring COVID-19 vaccines, the Ministry of Health and Wellness is expected to expend some $978 million on other resources to ensure success national vaccination program. This program will see 2 million Jamaicans receiving the COVID-19 vaccine by March 2022. Here's the latest COVID-19 daily summary as released by the Health and Wellness Ministry.
In the clinical summary for Sunday, February 21, 297 new COVID-19 positives were reported. The island is now contending with 8,083 active cases out of an overall 21,697. 3 deaths were also reported, leaving the death toll at 399. Of the new cases, 115 came from Kingston and St. Andrew, 62 from St. James, and 58 from St. Catherine. 12 were reported in Hanover, 11 in Trelawney, and 10 in St. Anne. Westmoreland has 8, while both St. Elizabeth and St. Thomas posted 5 cases, and there were 4 in Clarendon. Portland and St. Mary have 3, and Manchester has 1. The recovery total now stands at 12,988, with 57 reported over the past 24 hours. At this time, 267 persons are hospitalized, with 43 moderately ill and 18 critical. For the news on PBCJ, I'm Gabrielle Thompson.
The Governor-General, His Excellency Sir Patrick Allen, says resilience, innovation has been the government's mantra as it manages the economic and social fallout brought on by the COVID-19 pandemic. In pointing to a future recovery path, he noted achievements in education and agricultural sector as he delivered the throne speech at the recent ceremonial opening of Parliament. The Governor-General says the government's efforts have been directed towards providing equitable access for all and ensuring that students are equipped with 21st century skills and the tools to hone them. Tablets and laptop computers are being distributed via the Own Your Own devices and 1 laptop or tablet per child initiatives.
We thank our local business community, our diaspora and international partners who continue to contribute generously to the 1 laptop or tablet per child initiative, which has added 12,000 devices to the education sector, moving us closer to the elimination of the digital divide. Alongside the online modality, the government took steps to ensure no child is left behind and launched a national timetable to guide our students to lessons broadcast on television and aired on radio. Additionally, our teachers were deployed to help those students who could only access learning kits with printed textbooks and worksheets. Following on a successful launch of the Amber Heart Coding Academy, the government will shortly launch a pilot program to introduce our primary and secondary students to coding skills as we seek to develop creators rather than mere users of technology.
He says this new fiscal year, renewed focus will be on several legislations aimed at strengthening the education system.
For the new fiscal year, renewed focus will be on the Jamaica Teaching Council bill and amendments to the Education Act, while also putting our efforts on 1, the Children Adoption of Amendment Bill, 2, the Child Care and Protection Amendment Bill, and 3, the Access to Information Act and regulations.
Moving on to agriculture. The Governor-General says despite the challenges of the past year, growth of 1.8% was achieved in the second quarter and further growth is projected. And the government continues to put programs in place to stimulate increased usage of local products.
True leveraging of this sector requires significant investment. Accordingly, the government has since expanded the Production Incentive Program, PIP, to provide contributions to farmers. The ministry has also actively pursued development of the fisheries subsector through a relief program valued at $226 million for the provision of critical input.
He says the Ministry of Agriculture and Fisheries has also entered into a landmark partnership with the International Labour Organization to help informal operators in the agriculture and fisheries sectors to become formalized. The relative legislations to leverage these developments will be established. The World Health Organization says more than 6,000 Jamaicans died of cancer in 2020. More than 1,000 of them could have been because of inherited genes. Obstetrician gynecologist Dr. Sean Parkinson says inherited cancers can be prevented, and he's urging his colleagues to be more vigilant with patients who are at risk.
Depending on which cancer we're talking about. So for instance, breasts, about 5% of breast cancers are due to abnormal genes. So this may run in the family. So how we're able to detect this is whenever we're seeing patients, as a standard part of the history taking is to ask about their family history and the family history of certain cancers. Because not all these cancers are inherited. So specifically breast cancer, colon cancer, ovarian cancer, pancreatic cancer, and cancer of the lining of the uterus or the endometrium, among some others, including prostate, may be inherited. So when we take this history from our patients, they may tell us of a relative who may have one of these cancers. Now, if this relative develops this cancer in the 70s or 80s, it makes it unlikely that it's an inherited cancer, but especially when you're finding a number of family members with one of the aforementioned cancers at a young age, or multiple family members with any of these cancers, then you want to think of investigating that patient for a possibly hereditary cancer.
Dr. Parkinson wants more public education about preventing these types of cancers.
People are generally not aware. The myth out there, you only get cancer when you're old, until we're seeing these younger cancers now. And, smoking, alcohol abuse, the obesity epidemic that we're facing now definitely contributes to developing cancers. But as I said, these are sporadic cancers, and we know that these factors contribute. But the hereditary cancers will account for a significant proportion of cancers that we're seeing in young people. So people would be alarmed. This person is 25. How is it that they have breast cancer? So what we want to do now is to act rather than react. So when we're seeing these young cancers, we want to improve the awareness to say, first of all, the onus is on the doctors. Spend some more time with the patients. Take a more detailed history. We were taught in medical school that blueprint, family history. It's significant. So get into details to see if there's any cancer that runs in the family, what age, the type of cancer, and refer appropriately to the medical oncologists and the other specialists that can test for these inherited cancers.
You can hear more from Dr. Parkinson on the next episode of PBCJ's Blueprints to Health. Residents of Olympic Gardens, St. Andrew will soon have use of a new health centre. Ground was broken for its construction last Friday. The Andrews Muse Health Centre will be fully equipped with amenities for children, jogging and a walking trail, a green space, among others. Prime Minister Andrew Holness says the aim is to create a functional urban centre for the people who will use it. He says plans are afoot to build another infant school and a golden age home in his West Central St. Andrew constituency. Also, 2 more parks will be developed in the Olympic and Seawright Gardens divisions. The collaborative effort of the National Solid Waste Management Authority's Plastic Minimization project is proving to be a successful initiative. So far, it has garnered support from both local and international agencies. Melvin Pennant picks up that story.
It's day 2 of the Alternative Livelihood Seminar at the Paradise Street Basic School, right here in Raytown.
The National Solid Waste Management Authority pulled out all the stops to get the residents engaged.
Well, I like the local thing where I go on. Take care of the plastic them, because it make a mess, a real mess in the gully and all around, you see me? So I love to see what them do. More time I all bag up the thing to for them too. Because you are way to do it.
We are elated to know that our community is highlighted in a positive way. So this plastic waste minimization project is a wonderful thing because it teaches persons how to sort their garbage and how to properly dispose, because as environmental wardens we have to educate. Like they said, one man's waste is another man's treasure, and if you can recycle and you get back cash for these bottles, so we'll have less bottles on the road, we'll earn, and persons can make a living from that.
Last week's seminar was geared towards the youth and women of the community.
This week we will focus on the fishers and SMEs. So we'll sit down and have discussions with these two groups this week, and coming out of those discussions we hope to have a resolution in terms of how we'll manage plastics going forward. We have other partners, namely 360 and recycling partners, which we continue to work with, and we will work with those groups and to see if we can have a sustainable livelihood for the plastic waste being generated by the community.
Laced with a host of other government agencies, the Plastic Waste Minimization Project is no doubt at the front and center of the government's objective to tackle climate change.
The Promoting Community-Based Climate Resilient project is a project of the Ministry of Agriculture and Fisheries. The main objective is to build climate resilience in the fisheries sector and also to introduce alternative livelihoods to fishermen. Jamaica is experiencing different levels of climate change, and so this project is funded by the World Bank through the Climate Initiative Fund. So we are here today to share some of the information with the fisher folks of Raytown, presenting to them some of the alternative livelihoods possibilities, because Jamaica is overfished and we are affected by climate change.
The Plastic Waste Minimization Project is one of many responses to the problem of garbage destroying marine life.
You've never heard the term ghost gear before, have you? Okay, but it's something that you use every day that then goes into the ocean and becomes a problem. It not only creates ghosts, but it's a ghost in itself in the ocean. So it's actually called ghost gear. Ghost net accounts for approximately 70% in terms of weight of the plastic that is out there in the marine environment.
It's a good look. That's how the residents are describing the National Solid Waste Management Authority's initiative, the Plastic Waste Minimization Project, right here in Raytown. Melvin Pennant reporting for PBCJ News.
The Accountant General's Department is reminding pensioners who have not yet submitted their life certificates for the first quarter of the year to do so. The department, in a statement, says pensioners should recall that early submission facilitates the timely receipt of their monthly pension. The department says life certificates become due every 3 months, and each quarter's barcoded certificate is unique and must be submitted to the Accountant General's Department in its original form after it is certified. You should know that the life certificate is the official document that the Accountant General's Department uses to verify if a pensioner is alive, because the pension payout stops whenever a person dies. Last Friday, Prime Minister Andrew Hornet was presented with a book by possibly the island's youngest author. 16-year-old St. Andrew High student Carisi Oakley Williams gave the Prime Minister a copy of her book, Paradox. She wrote the book last year during the COVID-19 pandemic to inspire other young people to do good.
My name is Carisi Oakley Williams. I'm 16. I attend St. Andrew High School for Girls. I love to read. I love to write. I'm here today to present my book that I have recently published entitled Paradox. I wrote it in an effort to inspire other youths to choose the way of the Lord and just to do the right thing, and that it's okay to be a Christian, especially at a young age, and that is not a bad thing, it's fun. paradox in paradox is that it's being a teenager in this world, but you're not of this world. So the world has a lot of toxic natures such as violence, alcohol, drugs. But the book is in an effort to inspire you not to follow the ways of the world, but instead do the right things. My message to my fellow young people and future world leaders would be that you don't have to choose violence. You don't have to do the wrong things. I mean, yes, it's perpetuated in songs and they're always influencing us to take up the guns and to kill people, but we don't have to do that because the Lord doesn't want us to do that. He really does. He wants us to live in harmony and love each other, and so you don't have to do it. Yeah, you can just do the right thing.
The island has lost one of its foremost private sector executive. Greta Bogues passed away on Saturday night. Within business circles, Bogues was best known for the private sector organization of Jamaica's Corporate Governance Committee. She also made history as the first female chief executive officer of the Consolidated Business Association Secretariat of the PSOJ, Jamaica Exporters Association, and the Jamaica Bankers Association. Time now for a look at the ebbs and flows of the financial markets. Gabriel Thompson brings us up to speed with this business report.
In Friday's trading session, the JSE combined index declined by 612 points to close at under 400,000 units. Overall market activity resulted from trading in 88 stocks, of which 43 advanced, 26 declined, and 19 traded firm. The junior market index advanced by 21 points to close at under 3,000 units. Stocks advanced for 138 Student Living Jamaica, 1834 Investments Limited, and Barita Investments Limited. Stocks declined for Caribbean Assurance Brokers Limited, Community and Workers of Jamaica CCU Deferred Share, and Elite Diagnostic Limited. Trading firm were 138 Student Living Variable Preference, AMG Packaging and Paper Company Limited, and CAC 2000 9.5% preference shares. Trans-Jamaican Highway Limited was the volume leader with 4.2 million units, followed by Indies Pharma Jamaica Limited ordinary shares with 3.4 million units, and Wigton Wind Farm Limited ordinary shares with over 1.6 million units. Now for the foreign exchange. The US dollar on Friday, February 19, ended trading at $152.05. The Canadian dollar sold for an average $121.47. The pound sterling traded for $213.52, and the euro ended trading at $186.77. Oil prices rose on Monday as the slow return of U.S. crude output cut by frigid conditions served as a reminder of the tight supply situation, just as demand recovers from the depths of the COVID-19 pandemic. Brent crude futures rose 51 cents to $63.42 a barrel. West Texas Intermediate crude futures added 45 cents to $59.69 a barrel. That's it for this edition of the Business Report on PBCJ. I'm Gabrielle Thompson.
In regional news, we begin in Trinidad and Tobago, where 34 of Tobago's frontline workers received the Oxford AstraZeneca COVID-19 vaccine on Saturday. Earlier, the Tobago Regional Health Authority received 200 doses of the 2,000 vaccines gifted from the government of Barbados. More in this report from Ms. Douglas.
The COVID-19 vaccine for healthcare workers in Tobago started on Saturday at the Scarborough Health Center. Head of the Department of Internal Medicine at the Scarborough General Hospital, Dr. Ogana Okeke, was the first to receive the COVID-19 vaccine. He was monitored for a 15-minute period and reported he felt fine. Dr. Okeke said science has given a chance to fight back, and we should take advantage of this.
The only way we could fight back is with whatever else we have, and in this case, we have the vaccine. So that there's this saying that united we stand, divided we fall. A small country like Tobago, out there nowhere, is getting vaccines when most of the rest of the world has not seen vaccine yet. It's something which the government and both here and even Barbados showing that brotherliness, in this case, should be all commended for.
Head of Accidents and Emergency at the Scarborough General Hospital, Dr. Ian Sammy, was up next. He said when he received word Tobago was receiving the COVID-19 vaccine, he was excited and encouraged his staff to make themselves available to be part of the process.
So personally, I know that COVID is a risk to me. I work in the emergency department. Our staff are at very high risk. So I knew that getting the vaccine was the right thing for me after looking at all the information and understanding that as with any vaccine, there is a small risk of side effects. I believed that the protection it offered far outweighed any risk.
Meanwhile, health officials informed that the 200 doses have already been fully subscribed by 100 frontline workers. General Manager Primary Care Services Dr. Roxanne Mitchell stressed that receiving this vaccine does not relinquish the need to adhere to the COVID-19 protocols.
At the end of today, we probably have about 40 persons. 40 persons do not confer immunity or what we call herd immunity on the population. So even though we receive the vaccine and the illness may not affect us individually after receiving the vaccine, the virus can still come into us and we can then transmit. It will not affect us personally, but we can still transmit. So the onus is still on us to ensure we wear our masks, we wash our hands so that we do not inadvertently transmit the vaccine to persons who are not yet protected.
Carissa Douglas for TTT News.
And in Barbados, the health minister has made an appeal to the public to stay at home unless conducting urgent business following the island's weekend lockdown coming to an end. More from Barbados today.
Mandatory weekend lockdown has been lifted, but Health and Wellness Minister Lieutenant Colonel Jeffrey Bostic urged the public not to use it as a passport to venture out on the island's roads. A mandatory stay-at-home order went into effect on Friday, February 19th at 7 p.m. until 6 a.m. this morning. And in a national address last evening, Minister Bostic said, while the last 2 days were useful in helping curb the spread of the virus, the number of positive cases was still not improving as he would like.
Perhaps I should share with you the figures for yesterday alone so that you get an idea of how dangerous and indeed how reckless and irresponsible it is for you to be heading out every day with no urgent business to conduct. On Saturday, February 20th, a total of 756 tests were evaluated by the Best Dos Santos laboratory. From those 756 tests, 57 were returned as positive, 28 males and 29 females. 53 of the 57 carry Barbados ID cards. So after a clear 2 weeks into the period of pause, we still have 57 persons out of 756 tests being determined positive in a single day. That is too high a number. It is too high a positivity rate. It is telling me that we still have a long way to go before we can declare ourselves on top of the COVID crisis in Barbados. I know and understand very well that we cannot keep the population on lockdown forever. I understand that you have to go about your legitimate business. I understand that commerce must recommence. I understand that we need to keep the economy turning, even if not churning. But I would like to appeal to you to make each departure from your home a necessary departure, and a departure that is with focus and purpose.
The number of active COVID-19 cases on island now stands at 771. So far, 2,772 confirmed cases have been recorded, comprising 1,272 females and 1,500 males.
In the meantime, the Bahamian government is looking to cut back on spending wherever it can in the public service. There are still no planned job cuts for the sector. That's according to the island's Minister of National Insurance of Public Service. Jasmine Brown has the details in this report.
The National Insurance and Public Service Minister says cost-cutting does not include sending hundreds of public service workers to the unemployment line.
The government took the carefully considered position that during this pandemic and in this environment, The only persons who are steadily employed are government employees, and they will support their families. So that is the reason why no civil servant got a deduction or was furloughed during this time.
As the COVID-19 pandemic continues to drag on, so has economic uncertainty since the first case of COVID-19 was recorded in the Bahamas in March 2020. Restrictions during an ongoing state of emergency have resulted in many businesses shuttering their doors permanently. For much of the pandemic, major resorts remain closed for months, leaving many people out of work. Roll says the last thing the Minister administration wanted to do was add to the unemployment numbers.
We understand the seriousness of these times, and we just took the position that it was in the best interest of us and the service that we keep at least some persons employed, and the persons that we selected were public officers.
When asked if they had ever considered offering separation packages, Roll said this.
That's a noble idea, but my experience has been that we SEPs are offered to Bahamians, and then a year later they are the same individuals who want to come back to look for another job. And so, yes, there may be some agencies that are overstaffed or may consider that. Approximately just over 1,000 individuals leave the public service every year, and we have not increased that number. We have not increased the number of persons entering the public service. So individuals are trying to, at this time, keep a job. This is the environment in which we live, and we are not discouraging individuals at this time or encouraging individuals at this time to separate, except in those agencies where we're having difficulties. Bahamas is perhaps one of those agencies that thrives on government grants.
Reporting for our news, I'm Jasmine Brown.
In sports, we go trackside. We report on the 23rd staging of the popular Sagicor Sigma corporate run. The event was won by Calabar High star distance runner Kevroy Venson, while Josanne Harris took top honors on the women's side. The event, which in recent years attracted upward of 25,000 participants, was very much scaled down in this iteration owing to the COVID-19 pandemic. Overall, 36 males and 45 females ran in races separated by 40 minutes. 8 wheelchair participants also ran in their own races. The organizers ensured that strict health protocols were enforced. And that's our package. Join us right here tomorrow for more news and sports. Pleasant viewing.